All right, so I'm recording already. We'll probably give it a couple more minutes until we have some other people trickle in.
And I guess we should state right off the bat. I mean, both Jenny and I, quite people want to stop us and ask questions. It's totally fine. Process, yeah.
Yeah, I can go ahead with the introduction. So hello everyone who's here. We're very thankful that you guys are joining us tonight. And we're very excited and honored that we have Dr. Jennifer Kim and Dr. Michael Tokiwa with us for Heritage Month. And so what we'll be discussing today is the real world of veterinary medicine. So in the next hour, Dr. Takiwa, he's a practice owner and general practitioner. He'll lead the conversation with Dr. Kim, who's currently an oncologist in specialty practice, private practice. And they'll be discussing how general practice and specialty practice work well together. So this is going to just be an informal discussion to give participants an example of how we, as veterinarians, can work very seamlessly to provide the best medicine and care to our patients. And we have a few questions to help guide our conversation tonight, but please feel free to submit any of your questions in the chat and we can definitely answer those as they come in. Also, don't worry about limiting your questions to just general practice and specialty practice today. It is Heritage Month after all, so both Dr. Kim and Dr. Tokiwa feel strongly about promoting diversity in veterinary medicine and are proud Asian vets that would love to share their wisdom and their guidance from their journeys. So no limit in any types of questions that you guys have. So initially, I'm just going to start off with tell us a little bit about both of yourselves.
You want to go, Jenny, or you want me to go?
You go.
Okay, but before first, guys, just to celebrate Asian Heritage Month, I think there's nothing, we're coming out of a pandemic, as I'm very hopeful, but I know there's a lot of stress in the veterinary profession right now. So I think nothing's better than, just for Asian Heritage Month to pick up something like this, because nothing's better than Lego to relax yourself or anything like that. I bought this for my wife for Mother's Day. So it's good. With something like that. But my name's Michael Takiwa. I call myself the Canadian because I'm Canadian of Japanese descent. Graduated from University of Prince Edward Island at Atlantic Veterinary College. Phenomenal place. We had a great low number class. There was 53 of us, so we got to know each other very well. And after graduating, actually, let me backtrack. Before that, given my age at entering veterinary profession, I felt it was going to be a little too tough for me to do a specialty. So I always had it in my mind to own. So came to Jersey because that's where my wife got her job. So we came to Jersey and I worked in day practice, general practice for a few years. And then I started my own little relief business and did a little emergency on the side. And then I finally bought my practice. It was an existing practice, and then I developed it, and it's called Progressive Veterinary Care. So I've been an owner for about 15 years, and it's a general practice that I think we do a really good job of doing high quality medicine, and we're having fun doing it. I think it's the most important thing. About 6 years ago, for the heck of it, a colleague of mine approached me about doing a radio show. So I host a radio show called Your Pet Matters every Saturday morning. And then what morphed from that, with discussions of fellow colleagues, I do a YouTube channel and a podcast called The Collaborative Vet, which is really cool because that's exactly what we're going to talk about tonight. Yeah.
So I'm Jenny Kim. I went to college I did my undergrad at UPenn and I live in Philly now. And then I spent 2 years doing oncology research at the NCI in Bethesda. I did my vet school at Tufts. I did a rotating internship at Animal Medical Center in New York, and then an oncology internship at Cornell. And I didn't match for residencies. So I did emergency for 2 years in New Jersey, which is when Dr. Takiwa and I first met. And then I did my residency at Michigan and went back to my practice, but in the last year during the pandemic, switched jobs. So now I work for Blue Pearl in Philadelphia.
Great. Thank you guys for introducing yourselves to all of us. You guys definitely have quite a bit of a journey and a lot of experience in the veterinary profession, which is great. And so my next question for you guys is, what is it that you enjoy most about general practice and oncology?
Wow. What I actually, to me, it's interesting because to me, it's actually connecting with people. I always look at veterinary medicine as just a given. It's a given that we love pets. So to me, it's just connecting with people and helping them share that human animal bond. And I always look at my role as a practitioner is to increase the life expectancy and quality of life for the pets and thus helping the people who love them. That's what I love.
Yeah, I completely agree. Like yesterday, I had a client who was the daughter of one of my favorite clients. And her mom lives in Jersey, but she lives in Pennsylvania. And so it just so happened that she saw me. And unfortunately, we lost her father last year before the pandemic. And so we spent like 15 minutes in my lunch break just talking about him and our favorite memories. And it's like we become a part of the families. And so when we're thinking about veterinary medicine and you get someone who's like, oh, I want to be a vet, and they say, I like animals more than people, I'm like, maybe you won't like this job because our job is way more about people than it is animals.
Yeah, I mean, I totally agree. A lot of us initially think that, oh, we want to be a veterinarian for the animal connection, but our jobs really focus on the connections that we make with the owners and our clients, especially in general practice and specialty practice. So I think that it's really important for us to take that into consideration as well in the profession. And kind of on the controversy, what do you guys not enjoy about general practice or oncology?
Well, it's kind of a loaded question because like I'm an owner as well, so I think there's a lot of things with that.
Yeah.
How do I put it? So I actually became an owner for several reasons. Like I said before, I think it was an age-related thing. I had to add another how many years for a internship, residency, and specialty to my life before I could get out there and practice. So I was about 35 when I started practicing. So it's one of those things that I decided that I think it's very important to own. And one of the few lessons I've learned, I learned that our profession, we're underpaid, we're overworked, and we're overstressed. And the amount of dedication that I see veterinary team members put into the profession is absolutely amazing. And so there's a couple criteria that I decided to do as an owner. And it's kind of my goal is to change the veterinary universe, or put a little ding in the veterinary universe, if I could coin one of my heroes, Steve Jobs. It's to pay our team better because we're definitely worth much more. I truly believe that we perform the same level of medicine as human medicine. So I always talk to my clients as everything on par with that. You really want to pay the team well, and I'm really proud about what I'm able to do. And the second thing is just increase our quality of life. And it's very interesting that COVID totally changed things for all of us. You have to keep in mind, we were open the entire time. And I think the first few weeks we were like deer in the headlight about what we're going to do. And we kind of shut down, we closed our hours, figured out what we're going to do. We're scared to death about what we're supposed to do as far as protecting our team and ourselves and everything like that. But a couple things came out of it that I think are incredibly beneficial for the profession. What I did was I actually doubled my team numbers. So when I'm on alone at the clinic, I have 4 to 5 technicians with me and 2 receptionists. And what it enabled me to do is we're all inundated with double, triple booking appointments, right? There's huge, massive appointments being there. And so what COVID did was bring owners to their pets, then bring these pets to the clinic. And I think it's very great for the profession in that respect, but it's also very stressful. And so I think increasing the team numbers really enables me. My clients don't wait for an appointment. I can see same day appointments. I can see new clients, and we can rock and roll triple appointments at once. I'm out there running around between the cars talking to clients, but it really helped. And the other thing I did was the hours have cut back. So we work 8-hour days max. And I'm hoping to actually convert that down to 4 days a week only. And the gross has doubled for me. So it's just amazing what this can do. But that's how I want to, my team doesn't get stressed. They come in the next day. No one's overtired. No one's overworked. We have a great time. And so it's funny. It took 15 years of ownership for me to get to this level and COVID, but it's really created something. And I think that's my thing in the universe. And that's the way I think the future of veterinary medicine is going to be.
Yeah, I think that if you want a good boss, you want someone like Dr. T, because one of the reasons why I left my last practice is my boss was very into, you have to see everything, and I don't care if you're here 15 or 16 hours a day. And so I think that self-care is very important. I actually helped a Philadelphia Inquirer writer write an article about suicide in veterinary medicine, and she spent the day with me and took pictures of me with some of my patients, kind of explaining what we go through. If anyone wants the link to that article, I think she did a really good job. And I think that we need to change the philosophy of go, 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 and, change the thought of it being about money. And so I took a pay cut for my new job, but I get home by 7 every night. And to me, that was so worthwhile. And I think that as right now, everyone's looking for veterinarians. So you should be demanding it. Because there are more jobs than people right now. And I think that we as a culture need to, as associates, say that we need a quality of life. And then I want to put a plug in. I want people to be more active in the community and citizenship. So I'm on the New Jersey board of the executive board for the Veterinary Medical Association. And I'm not there because I'm so special. I'm there because I wanted to do it and I volunteered. And very few people volunteer. So there are a lot of people who kind of like bitch and moan about everything, but, walk the talk. So I'm very active in ACVIM. I just got appointed to another committee. And it's just like, I know that I'm going to make a difference in our, a small difference, but I'm going to make a difference in our industry. And I wish more people would do that.
Yeah, I totally agree.
Yeah, I think, so along the lines of our discussion tonight is making a difference. So, how can we make a difference in pet lives, right? So going back to, how long have we known each other, Jenny? Years, right?
Well, so 2005 was when I started.
Okay. Yeah, but we're only 29, right? So we were quite young at that time. So
yeah.
but it's funny because I think that I think the basis, one of the basic things between I call myself a day practitioner. I don't know where I got from GP. I call myself a day practitioner because I'm not open 24 hours. I come in during the day and I do what we can and everything like that. And I think that creating relationships with not only your peers within the day practitioner field, but equally important is creating relationships with specialists. And Jenny's one of those people that I got to know really well that, we're at the point where I can text her one of those stupid questions about oncology and she probably laughs, but she'll text me back and give me the answer that I need. And I think that's a huge thing on increasing the quality of pet lives. I joined this, everyone should go to this website, the collaborativecoalition.org. It's an organization that they truly believe that the relationship between the day practitioner and the specialist is huge. It's important. It's underdeveloped. It's undernourished. But at the end, that sort of relationship actually leads to better quality of life for your pets and better long lives. A research paper came out. One of the original board members, Bonnie Lefbom, she's a cardiologist. She published an article in JAVMA that basically did a retrospective study that showed that small dogs with congestive heart failure that were not just singularly managed, but co-managed between people like me and cardiologists actually lived 77% longer than pets that were just singularly managed, whether it be specialists or general practitioners. So to me, that was a huge, huge point. For those business owners out there who are always worried about losing business to specialty and referral centers, that study also showed that it generated 22% more revenue for the primary care facility, simply because what Jenny and I do is I have that difficult discussion that there's cancer involved in my patient. I go see Jenny. Jenny will then take care of you, do what needs to be done, and then it's almost like a flip flop. She'll go back to me. Let's do what we can in practice, because the relationship that I have with the client is the initial relationship. Then their trust is developed with Jenny because I simply refer them to someone I know, and I actually say that. And then Jenny develops a relationship with them. And in the end, we basically kind of co-parent the pet parents into better healthcare. And I think that is huge. So developing relationships amongst our profession, and that goes across the board. I always tell my students, it's who you know. It's who you know. I think it's huge. So build your network. And as I always love saying is bug the crap out of the specialists, because when you bug the crap out of them, you call them up. What's beautiful about specialists is I can reach out to people like Jenny and they will respond. They will respond right away. It's not like, oh no, it's not. Yeah, I call in for an IDEX consult, right? And I hope they call me back in the next day or so, but I will text Jenny, or I will call an internal medicine buddy I know, or I'll call our equal friend. Jenny and I know another Asian surgeon, Dennis Ting, and we just call him up and you get these answers, you develop these relationships, and it's just phenomenal because I learn, and it just nourishes my ability to be a better practitioner.
And an example would be like, so Dr. T calls me about a case and I start chemo and I send it back to him for the blood work in between. And then the dog develops a limp. And so then I send it back to Dr. T for Rimadyl or physical therapy or whatever he needs. And because I'm staying in my lane, but I'm also cognizant enough of what he does, I can be like, hey, FYI, Fluffy came in, he's limping, he's going to come back to you. And sometimes when we send cases over, I'll send it back to him for surgery, but I'll call him first and be like, hey, is this something that you guys feel comfortable doing? Or do you want me to do it with one of our surgeons in our practice? And the clients really like that. When I go in the room, I'm like, oh, I just spoke to Dr. T about Fluffy, and he has wonderful things to say about you. Instantly I get street credit just because I spoke to their vet.
Yeah, so that brings up a point that there's a criticalist I know, and he told me that we talked about what's called the emotional bank. And so if I have a client for 5 years, let's say, I've had 5 years of interaction with this client, in which case we develop a huge relationship, we develop a trust. And so I have this emotional bank that is huge. Even though I'm telling them, hey, go see Jenny, Jenny meets them for the first time and her emotional bank is about this big, right? And then she's sitting there, she's talking, okay, this is what we're going to do. And, since it's referral center, when you make that estimate, it's not like this is going to be $300. No, here's what this, typical chemo plans are like 6 to 10 grand all said and done, right? When you do everything. So there's a very small emotional bank. And I think that the ability to then discuss things with someone like me, their GP, that, hey, listen, whatever Jenny's doing, I totally agree with. And I trust, then that then increases the emotional bank that Jenny has. And then over time, especially in oncology, you build a huge emotional bank with your clients because you're seeing them for a long time. And so then it's so good to have that. It's so good to have that. I think it's great. And the other point I'd like to make is that I also went into veterinary medicine was appealing to me because of the jack of all trades aspect. Hey, you can do surgery. hey, you can, look at x-rays, you can do dentistry, you can do all these things. If you're interested in nutrition, dermatology, ophthalmology, as a day practitioner, I can dabble in that. I like dabbling in that. I like being the Leonardo da Vinci type dabbler of everything, but I'm not an expert. I'm a handyman, but expert really of none. And so, I always tell clients, I said, listen, someone like Jenny, this is what she does. This is 24/7. This is what she does every day. And there's no way I can even match what she does. And I was, when you were talking, Jenny, I was thinking about, when you do CBCs, right, for follow-up for chemo, I go, I don't know if this is low enough. I don't know if this is low enough. So I always reach out to Jenny, like, is this okay? I think that those are very important things that, I know there's a lot of day practitioners out there a little leery about, having that relationship with specialists. And I think it's very important because, think of the patient care always comes first. And I know that having that relationship, relying on that expertise. And sometimes with Jenny, it's just a matter of, hey, Jenny, what do you think of this? Even if I approach it from my perspective, and she'll give me the pointer. She goes, yeah, you can do this, but, or, yeah, sure, you can do this. And so I think that just helps me just be better for my patient care.
And find the specialists who won't give you a hard time, even if you're not referring the case. Like, as specialists, and if you do specialize, like, think about it. Like, the fact that Dr. T can call me about cases he's not going to refer means that he will probably refer me cases in the future. But I'm always there as a resource. And that's the way I see things. And I've worked with specialists who are like, he keeps calling me, but he doesn't send me anything. And that's a really poor attitude to have, because we are here for the animals.
Yeah. And I think so that phone call is actually developing the relationship, right? I had a case where, like, I've had cases where they go to different referral centers. They get a call from the client. They're over here. So I call over to the specialist, A, to introduce myself, and B, to create a relationship, so that you just never know what the future is going to be. Our veterinary profession is so small. I used to think we were 2 degrees of separation from every vet in the world. Actually, everyone here knows a vet who knows someone who knows you, right? So we're like literally 1 degree of separation from every vet in the world. And I think that creating that network is huge. I'm probably going to babble on about networking, but I think it's probably the best thing you can ever do.
Yeah, absolutely. Make friends with all of your drug reps, because when things happen, like, I still get Palladia when Palladia's on back order. So just be nice to everyone. Don't make enemies.
Yeah, drug reps and mobile specialists, they get the inside scoop of every practice.
Oh, yeah. If you need anything, if you're like, what's going on with this? Yeah.
Yeah, I mean, I agree too. I think that the connection between day practitioners and specialty practitioners is really important. And I was just on internal medicine recently, and I think that the day practitioners really appreciate it when I give them a call and I update them on the case, and I'm like, hey, this is what we found. It's a really rare disease. This is what we do to treat it. And I send it back to them for them to manage it. And I'm always like, hey, if you have any questions or concerns, please reach out to us, because that's what we're here for. We're specialists for a reason. And we want to keep you guys in business and keep the connections that we have with our clients. So I think that's really important to have those relationships, for sure.
Yeah. And at this point, I don't know anything about tick medications, ear infections. Like, they don't let me hold sharp objects. So, like, clients are always just like, you're not going to do the surgery? I'm like, no, you don't want me to. That would be dangerous for everyone.
And you bring up a good point, Kelly. I think one of the concerns that a lot of day practitioners have are, when your patient is at referral, you kind of want to talk to that specialist, right? And so I think it's awesome. I as often as you can, keep making those phone calls. What it will do is build kudo points between you and that day practitioner. I think it's better medicine. And one of the valid points that we should discuss today is that, so I'm fortunate that I have 5 referral centers within a 30 to 40 minute drive from my practice. So I'm very fortunate about that. And I think that's why I have a lot of relationships with specialists, but a lot of the clientele, right? So who makes up a fair amount of the clientele for a referral center? It's the referring veterinarian, right? You're going to get some emergencies coming in or whatever, but it's the referring veterinarian. So I am basically the client of most of the referral centers I send to. So I think it's very important to have that mindset so that your relationship with your clients is important. And so what you're doing, Kelly, is you're solidifying that relationship. I can guarantee you that a day practitioner can talk to you and not know who you are, but by the end of the day, know who you are. They are definitely going to consider referring to you again, simply because you communicated with them. I think it's huge.
Yeah, communication is really big in the veterinary profession. And I think we don't think about it as much because just in our profession in general. So I do agree that it's really important for us to make those connections and have that as a backup and be able to talk with one another about cases, because that's how all of us learn in general about these rare diseases that we get sometimes. So I think that it's really important for sure.
Yeah, and a piece of advice for young vets out there is, everyone goes to VIN, right? Everyone goes to VIN, but VIN is moderated by specialists. So why don't you just take the real VIN, so to speak, and call a referral center or call a specialist and ask them the question that you're actually discussing. Today I had an issue with lepto. We're doing all these titers and stuff, and I talked to a specialist. Hey, what do you think about this lepto titer? What should I do? The whole family's dogs had lepto, and we treated them and everything, and these titers are remaining high. And I go, okay, so what's how long is it going to last? What are we going to do? And I was giving some really good advice today. So I wouldn't have had that if it wasn't a discussion. One-on-one discussion. I think it's important.
Yeah, and it also, if you are a specialist, don't be afraid to ask your friends if they've seen something you haven't seen. Like, my best friend is also an oncologist, and one of my colleagues at a sister hospital and the three of us are always talking to each other about things. Even if we know the answer, just be like, I just want to bounce this off of you guys. So even if you're an oncologist and you're the only one at your practice, have those connections so you don't ever feel alone.
Yeah, I agree. I think being able to talk amongst other veterinary professionals is really big as well, because being able to kind of discuss things and figure out the best treatment for our patients is really what it's all about. So I totally agree. Do you guys have anything that you would recommend for, I know we kind of talked about veterinarians in this aspect, but in particular veterinary support staff and what they should keep in mind when specialty hospitals and day practitioners kind of collaborate? I know it seems like kind of a lot of back and forth sometimes, and I don't know if you have any recommendations for talking to the support staff about that, or how to maintain a good relationship between GP and specialty hospitals.
Yeah, I got a couple pointers. So inevitably in the life of a pet, something is going to happen that is not good medically, in which case you're going to have to bring your pet to a referral center. So I think it's very important with support staff to actually learn about the relationships that and the specialists that exist in those referral centers. I think every single team member I've ever had has had to take their pet to a referral center. The most recent is my admin's dog. He's Cushinoi, but he also suffered from acute kidney failure and had to go to referral centers. And that process, I referred him to my internal medicine friend that I know. And so it's interesting because the way you're treated when someone knows you is a bit different. And the ease at which my admin had interacting with my specialist. I'm going to plug him, Pete Chapman, VSAC.
He's great.
Pete Chapman is amazing. Pete, I owe him a drink anyways, but it's because of this. But I think it's just the relationship was there. I can call him up saying, listen, my admin's dog is suffering. Can you help him out? And he goes in there. And the benefit is that there's just a little difference in the whole approach. And so understanding the process, I think the process is important for team members to understand is what's involved. Like, so in today's day and age with COVID, there's going to be a wait, right? Right now, one of the referral centers told me, don't send people through emergency to see specialty. Do not do that. So now you have to, what is the process of making an appointment? What if it is urgent? What's the client supposed to expect? So then they will go in through emergency. They'll be dealing with an emergency vet and then transfer to the specialty field that's pertinent to that situation. I think a huge thing that all team members should know is how much is this going to be? So I throw out figures like, listen, that there are situations when you go to referral that you could be talking thousands and thousands of dollars. So you have to be prepared for that. And I think nothing's more frustrating from a client's perspective to not know what to expect. And so they're already stressing. They bring their pet over and then they get this estimate that's huge. I think it's very important to understand the entire process. And then what's involved afterwards. So if everything goes smoothly, how long are they going to stay there? And then what is the follow-up care? And so I think every team member should have that sort of understanding from CSR team members when the client calls. We've had situations with emergencies where if that client is closer to a referral center and it's urgent, I'm not going to say, hey, come on in here and then I'll do what I can and then ship you out. We'll say, hey, you were really close to emergency, so go there, but this is what you need to expect. And the only person they're actually talking to is the CSR team member. So I think that everybody should know things like that. I have an added benefit, or I'm blessed that I have some mobile specialists come to my practice. And so those types of relationships are really good to have. And you know, like Dennis Ting, my mobile surgeon, to have my technicians know what's expected of them in surgery with respect to what he does is very important because it's completely different to what I do. Dennis, the guy is super clean, man. He doesn't even like little bleeders, and he's super brilliant. And so completely different history story when I'm in there. So it's one of those things that I think is very important for team members to know.
Yeah, and I make an effort of going to the practices that refer the most to me and meet everyone. Like I will say hello to the receptionist, say hello to the technicians and be like, here's my number, call me if you need anything, because that touch point means that that person can say, oh, I met her, she came to my practice, or I saw her on Zoom and she was really nice and she answered my questions, and you'll love her.
Yeah, I think that's a really good point that I've never actually thought about, is actually going to day practitioners and introducing yourselves to them. That's a really good point.
Huge. It's huge. And the thing is the receptionist, like the doctor may say to the owner, okay, well, there's these 3 specialty practice and I like all the oncologists, but the person at the front desk is like, oh, Dr. Kim treated my dog, you want to go to her. You know, so it can come from the vet, but it can also come from the front desk staff. And I treat my support staff like gold. So if you're a manager at a ref vet, you're not really paying anything. I am using all of my like little bit of comps that I have on that patient because 1, I know she's not paid enough. 2, I know she's doing a lot, and I'm doing it for the pet, but I'm also doing it to build that relationship.
Yeah, I think building the relationship is really important.
Yeah, and so along those lines, so a lot of referral centers, they'll have a liaison bring a new specialist to the day practice. I think from your perspective, Kelly, is that what you do is give a little, like, you know, lunch always is great, right? free meals are always great, right? So you can do that and you can give a little talk about a particular subject matter. And so then that creates the relationship. You're educating the team members at the day practice, and you're showing them who your face is, right? Because on a piece of paper, you get to know these names on paper, but you want to link it with a face and then a voice. And so then it'll make them think about going to you. Yeah, it's great.
Yeah, I agree. It makes the experience a lot more memorable when you can actually physically see the person and talk to them. So I totally agree. And now I'm definitely going to do that in my future for sure when I become a medical oncologist. I think that's a great idea.
They'll make you.
Good to know.
Yeah, and like I do a lot of evening continuing education, more formal than tonight, but I do a lot of things like this. But I enjoy doing it because I feel like it's kind of my mission, especially a lot of veterinarians don't graduate vet school with enough oncology, in my opinion. And so whatever I can do to empower the industry, empower the people around me to feel better about how they're approaching things, because you're going to diagnose cancer all the time and you aren't equipped. You just aren't.
No, you're not equipped. You know, I look at school in general, 20% of what you learn is what you're going to apply, but you learn more in your first year out than anything. It's all practical. And, you know, vet schools don't prepare you for, even though they have management courses, nah, they don't prepare you.
No.
They have communication courses. No, they don't prepare you. You know, I jokingly tell all my young students who want to be vets, I said, you know, you spend time at my practice, you're going to know exactly what it's like to be a veterinarian. And, you know, I've had some students become vets. I've had some students go, no, this isn't for me. And so they become successful in other places. But yeah, it's, I think just learning those experiences are huge. Yeah. And then, you know, my take on the future too is where is this future going? Where is this collaboration going? That I think there's a lot of specialists graduating. And, you know, how many referral centers can there be, right? So I see this trend towards a couple things. There's from the design element, there's a trend towards one-stop shopping, where a lot of these veterinarian designers they're developing these units where you could actually have people living there. You'll have a pet store, you'll have a groomer, you'll have a veterinarian all in one. And it's one-stop shopping. And then what I see for the future is, because of all these specialists coming out, there's a lot of mobile specialists right now that are doing very well. I think that most day practices like myself will have some form of mobile specialty in any way, shape, or form come on a regular basis. Or if I was a bigger practice, I would probably actually have certain specialists built into that system, get a little bit out of the big referral centers and go back into the day practices. Because as corporations come and take over practices, I think the culture is changing a little bit. And I think you're going to see these more what I call boutique type style practices continue and maintain. So if you're specializing, just think about things like that.
Yeah. But I also will say that I think that when we go to vet school, the focus is on specialty because that's all we see. And so everyone thinks they want to do an internship and do a residency. And I took time off between my internships and residency. And actually, I got offered oncology residencies before then. And I said no, because I didn't want to do it.
Oh, wow.
Yeah. And I was just like, no, I'm happy with my life. And then just on a whim, I took the residency, but I didn't need that. And so we're actually, I'm involved in a project that is trying to create a veterinary school that is going to produce good general practitioners. And so it's going to be like no veterinary school out there. And it's something that me and one of my friends are very passionate about. And so we're trying to create a new way of approaching vet school. So this school is going to have a lot of dentistry. It's going to have a lot about, you know, the things that we don't get, like eyeballs and dentistry. Like, you guys need to know that.
Yeah.
And so I want people to be okay with being a general practitioner, because honestly, residencies suck. And I made more money as an overnight emergency doctor. So, but I had no quality of life.
Yeah.
So
Jenny, you forgot derm and behavior as for your vet school, right? You need derm and behavior put in there as well.
Yeah.
Yes, absolutely. And so that's what we're trying to create. And I think that we as an industry have to be pushing more towards creating good general practitioners versus so many specialists that, you know, I end up seeing broken legs. Like, you don't want me, you know?
Yeah. Yeah, I think that that's a really important thing, especially in vet schools nowadays, because this generation, a lot of us focus mainly on specializing for sure.
Don't do it.
I'm ready strapped.
I mean, what you want to do is, I talked to a neurology resident before, and he said, listen, you have to look at, well, let me backtrack. Before I got into vet school, one veterinarian gave me great advice. He was a wildlife pathologist. And he told me that when he graduated from vet school, he was going to be a large animal vet. This is what he did. And he said his first job was, he gets a job. It's a single doctor practice. So it's him and the boss. And the boss basically said, I'll take this half of the county, you take that half. He said within a year, he was back doing his internship, and he specialized in wildlife pathology. The second advice he gave me was that he said 20% of what we do, no matter whether we're specialty or general practitioner, 20% is the things that really drive us. It's really, oh my God, this case, this was amazing, or I was successful doing this. 80% comes what we call pseudo routine. So if you have that mindset, then you understand what's going to happen. A friend of mine is a neurosurgeon. He said 90% of what he does is carpal tunnel syndrome, but 10% he gets to do the brain surgeries and everything like that. So he just lives for that 10%. So you have to keep things like that in mind. I encourage specialists. I think that what we're doing now is that we're talking about our quality of life, right? How much money can you make as a specialist versus a GP and things like that. I think that those discussions need to be had. I think there are some very successful GPs out there. There are some very successful specialists out there. But when you're looking at, what am I going to make as a specialist, and what kind of lifestyle am I going to have versus a GP, you have to take those things in order. But I think there's happy medians everywhere, and you have to just find what you're going to enjoy. You're going to be doing this for 20 to 30 years. So is veterinary medicine for you? Even you go back to that basic question. You have to think about doing something for 20, 30 years that you're going to enjoy. You don't want when you hit that third year out, the third year hump where you think you know everything, you think you should know everything, but you're going, I still don't know everything. You have to realize, like, I'm going to be doing this for another 17 plus years. So is this something I want, and am I happy doing it?
Mm-hmm.
Yeah, I'm almost 20 years out from vet school. And I think probably at least 20% of my classmates no longer practice veterinary medicine.
Wow.
And so but it is a versatile degree. So I have a friend who's an epidemiologist and works for the CDC. And so her COVID postings have been amazing because she's really in the thick of it.
Mm-hmm.
I have another one who's the Minister of Health of Hong Kong. So there are different things that you can do, but I think that burnout is a huge deal right now. And it's a big discussion in the education research positions that I hold, both in New Jersey and in ACVIM, is talking to people about quality of life and making sure that we have the resources and the ability to help people.
Mm-hmm.
Yeah, and I think COVID really brought that to the forefront for our profession. I think we were already kind of overworked and stressed, and then we got everything, just boom, everything hit us really hard. So
Mm-hmm.
I think that you really have to, and I think I see a lot of change. That's when a lot of people are going, oh, I'm making this life change. So just keep those things in mind. You have to enjoy what you're doing. Yeah.
Yeah, I agree. Quality of life is so important, especially in this profession, for sure. And we just need to make sure that we always make time for ourselves, no matter what. And even if we work long hours, that we need to, like I said, take time for ourselves and kind of step back from our jobs a little bit and be able to separate work-life balance, for sure, because that's how we experience burnout. And that's when us as a profession, that's when people leave, because they're just so stressed with the job. And so I think that it's great that at your private practice that you make sure that everybody only works 8 hours a day. I think that that's important for their quality of life, and keeping the technicians that you have and the receptionists and making them happy, and having a good team and everyone's happy with their work-life balance. I think that's really important in having a successful veterinary practice, specialty hospital, just everything in general, for sure.
The other thing that I would say is don't bring it home to your non-vet spouse. Okay. Like, I can't even tell you, I'm forever single. Okay. And every relationship that I've been in who's not a veterinarian cannot deal with what I bring home. So I try not to bring it home, but sometimes it's hard.
Yeah.
Like, I've been called a mercy killer, and been told that, like, why are animals getting chemo when some humans can't? And it just, like, people are terrible sometimes, but it's a job that is it's like, I used to only date cops and trauma surgeons, because we kind of have the same jobs where you're just like, yeah, we leave it at work and we're like, okay, let's have some good food and a beer, you know. But it's true, because I have ruined relationships by taking it home, and we have a high divorce rate because we have hard jobs.
Well, I mean, I think to your point, but at least you get home, right? You know what I mean? So one of the biggest things is, I remember one of my technicians on Cinco de Mayo, yeah, I have like a 6:15 appointment here to do this because we're gonna party this. And I come up to the team, and I go, guys, remember when we couldn't even say that we can get somewhere at 6:15? You know, I go, so I think it's important. I think there's two things here. Number one is, no matter where you are in the profession, no matter what you do, get a mentor. Mentors, I tell these young vets that are going to own, I go, man, just talk to me for half an hour and I will save you 5 years of heartache about ownership or whatever. Cause, and I'm willing to impart that. I don't know anyone who's not willing to impart that knowledge. I can tell these great stories about things. But I think it's important to get a mentor, because they've been through it all. They've lived through it, and they can give you advice that will change your ability to look at that situation. You know, I think it's very important that way. And I think the second thing, and I think it could be said for most of us veterinarians, I say we're the cooks of the medical world, right? We're the one, oh yeah, let's use this off label, or let's try this, or I'm going to do this or whatever. So we have this different mindset. Our brains work differently than engineers or even doctors, right? Doctors are trained to do specific things and everything, but we have this mindset because we're looking at different species, because we're doing all these different things, even if we're specializing, we're doing all these different things and not being isolated to one thing. I think our brains work differently, which means we probably have some form of hobby outside of veterinary profession, that is, whether it's art, music, anything. I say keep that hobby alive, learn something new. Nothing is worse than just being able to do one thing, because then you don't have a life outside this profession. This is my career. I love it, but it is not my life. And I think that's very important. You know, now that I have a son, this guy takes priority. Right now I have 3 kids. 2 are 4-legged and 1's 2-legged. But you know, you have to have priorities of what things are. And if it means I don't want to miss a recital, I don't want to miss things and have regrets, right? So how I always think about how I can change the way my business functions so that I can meet the demands of the profession and yet have a good life outside the profession.
Yeah, I think that's important, for sure. So kind of wrapping up, I know we have a little bit of time left. We have 10 minutes, and I kind of want to go back to AAPI just in general. So I just wanted to ask your guys' opinions on, do you think that there is a lack of Asian veterinary professionals in vet med, and what do you think that we can do to kind of fix that, for sure?
You want to go first, Jen? You want me?
I can. So I think that our numbers are increasing. I think culturally it's easier for us to take a step back and kind of not be involved. And I think that we need to change that and be more vocal. Because I think we're out there, but I don't think we're doing enough to promote ourselves and to really move our force within the industry. Like, I am almost always at these big committee meetings that I'm at. I'm almost always the only person of color. I'm almost always the only person in private practice. There have been several meetings that I've been to where I am the only non-old white man. And it's not because other people, it's because simply people don't volunteer, you know? And I think that if you, like, one of my friends yesterday was like, he's really jealous of what I'm doing with the industry because he feels like he doesn't have a purpose. And so, yeah, I'm going to go hiking. I'm going to do 10-mile hike tomorrow. But when I get home, I'm going to be rewriting the bylaws for the New Jersey VMA. And so Dr. T says have a life, and part of my life outside of my work is promoting our industry and being that Asian representative in these places.
I think there's a couple, so I'm in the Princeton area, and believe it or not, when they have these high school get-togethers about becoming a veterinarian, they're actually discouraged to become vets because of the lack of income and the student debt ratio and everything like that. So I've had these discussions with students. I go, it doesn't matter what profession you go into, you're going to have this huge debt coming out, whether you're lawyer, engineer, doctor, whatever. It's just that, what I think the onus on my generation, or what I think about, is changing the perception about veterinary medicine. And that is making it so that, we need to keep our fees to where they need to be. We need to make X amount of money so that we're going to change this. It's not going to change my life per se. It's going to change the future veterinarian's life, so that there's not this perception that we don't make money and that we're overworking everything. I think that, like I said, there are veterinarians out there that are making really good money. It's just how you do things. The second thing is particularly pertinent to Asians. I have a Chinese American high school student who, she actually works for me because she wanted to become a veterinarian, but there are family pressures on her because her cousins are human doctors. The whole perception about veterinarian, and her mom even says, you're not going to make enough money. It's this huge perception that I think that we have to overcome, as Asian representatives of veterinary medicine. I didn't enter the profession for money. I had a great idea of how much we made, but my goal is to change that perception, right? Like I said before, we do the same things human medicine do, and we actually do things better, not to knock any human doctors out there, but we're calling blood work back right away. Like, I joke when my human doctor goes, yeah, we're not gonna have blood work in 2 weeks. And I'm like, that's not right. You're getting it tomorrow. You're just not gonna call me in 2 weeks, right? So I think there's a lot of things we do better. We do way better communication. I think that the ability to look at a pet and do your physical exam and realize what's going on without them saying a word to you, or having the client like not there half the time because it's COVID, is incredible. So I think, and all our specialties are doing things that human medicine does. So I always say we're on par with human medicine. And I think that is important for us to change that perception about veterinary medicine.
Yeah, I agree. And so, have you guys ever experienced any microaggressions throughout your journey as a veterinary professional? And I just kind of want to know, like, how you dealt with that, and if you have any advice for our fellow people that are listening. Like, what is your advice for dealing with things like that?
Yeah, Dr. T and I were actually talking about this, and he doesn't get it so much, but I get it a lot. Okay. And I'm in a liberal, well-educated area, but people are just stupid. So I had one guy tell me, you speak American well for, oh no, you speak American good for a little Oriental girl. And I was just like, I speak English well for an Asian American doctor. Like just this week, I had a client who's like, so what's your nationality? And I said, American. He's like, well, where are you from? And I said, New York. And, I know what they were digging at. But it's just like, no, you don't, if you can't, I'm a little bitchy about it. Okay. And then I had another one, a guy who was like chasing me around the waiting room because he knew I was Korean. And he was like, oh, I served in the Korean War, and I want to talk to you about Korea. And I was just like, well, great. I am so glad that you served our country, but I don't have time. And I've actually never been to Korea, so I'm going to go see my patients. Like, honestly, I cook better Italian food than Korean food. So I think that being able to hold your composure is really key. I've had clients kiss me on the lips, like, and it's just like, you're going to get yourself into situations. I'm very cognizant of my spacing when I'm in a room with a client. I will not use an exam room that doesn't have 2 doors, because I know that I need to have an exit if a dog is aggressive, if a human is aggressive. I think that as women, these are things that we need to be cognizant of. And so my practice right now, they don't have 2-door exam rooms. So they're actually creating a space that I can feel safe in. So don't be afraid to do things like that, because it's like, I've worked overnight emergencies. I've been in some sticky situations. And those microaggressions, you have to realize that 90% of it isn't malice, it's just ignorance. And so how you deal with it is how you want. I'm probably not the best with it, because I'm just like, are you freaking kidding me, you know? But like, have something in your back pocket, have those conversations in your head. What if this happened? What would I do? So that when it does happen, you're not taken off guard, because it will. Okay. Like those creepy old white guys who like have that the yellow fever, like they're out there.
It's real. I've experienced that too. And it's not fun, and definitely being able to understand how to handle those situations is really important. And it is mainly just ignorance, for sure. I agree. Which is really unfortunate for the day and age that we're in, because that shouldn't be the case at all. So all right.
And I think that things have gotten worse.
Yeah. Yeah, I agree, especially with the
I
pandemic.
wanted to mention,
Go ahead.
sorry, Kelly, I think you're lagging a little, but I just mentioned we've got a couple comments in the chat of people saying that they've gotten the Korean War statements as well, and that they've got comments where they state their wives are from the Philippines and somehow try to relate that, as Dr. Kim said, to Fluffy and why Fluffy is coming here. And I, have a kind of a different situation where I have the whole, so you're aligned with terrorists, right? Is kind of like my end of the spectrum. And then also the, oh, why don't you have that thing on your head, and those kinds of statements. And I've luckily been at practices where I've had staff support me through that and kind of give me that exit that I need. But I also kind of take Dr. Kim's approach where I'm kind of bluntly bitchy about it. And it's worked out so far well for me. But I appreciate you kind of mentioning that.
And I apologize, guys. I really haven't experienced a lot of this. Like, I remember when I went to vet school. So East Coast Canada is kind of like, it's like island mentality. Literally, it's an island of about 150,000 people, and some people really haven't left that island. And so I went into an antique store when I moved there, and I went to the right side of the store, and my wife went to the left side, and she's Caucasian. And so the store owner came up to me and he literally said, "Hi, can I help you?" And without skipping a beat, I said, "Nah, man, I'm just checking things out." And the look of shock on his face was amazing. And so I've had situations like that. I think that I think coming to the States, there's a totally different sense about immigration and accents and everything like that. So I take it upon myself, just in general, about race and religion and everything. It's just inclusion. So if a team member is having a difficult time understanding the accent of the individual, I will then go out and talk to that person. And in all honesty, the accents don't faze me at all. And so I'm trying to just increase that inclusion there. And I think some of the reasons why I don't get this microaggression is because I'm a man, B, because probably I'm in your face anyways, and I'm just talking like this, and they I don't know, maybe they see by this crazy dude or anything like this. But I feel very fortunate that I think it sucks what you guys have to deal with. And I used to joke that when I went to Princeton, there's a huge Asian community. So I walked down the street, hey, yeah, I'm with my buddies and everything like that. But I've been the only Asian dude anywhere for vet medicine for a long time. That I mean, when I met Jenny, right, then we met Dennis, we created a little Asian gang of vets and stuff like this. And I joke with like with Justine Lee, hey, we're all Asian and everything like this. So I think it's fun to do that. I joke about Asian stuff just to lighten the mood and everything like that. So and I find a lot of times that really breaks the tension for team members who are not who are minorities. But I really take it upon myself that as a minority, I represent the entire Asian community. So how I act and everything like that will reflect upon that. And I want to make that a good perception, a good interaction with non-Asians.
Yeah, and real quick, make sure that you work for a company who will let you fire clients who are being, because I worked at a place that didn't, and that was one of the reasons why I left.
Mhm. Yeah, I think that that's important for sure, because you want to be comfortable being able to work where you're working, and
Yep.
having to face microaggressions is puts another stress on the job that shouldn't need to be there, especially in the community and the day and age that we're in. So since it's 8:02, we're just going to kind of wrap things up. Thank you guys so much for attending, and thank you Dr. Kim and Dr. Tokiwa for sharing your valuable insights and experiences in the profession. For all of those that are still watching, if you've missed any part of the interview and would like to hear it again, we will be uploading this talk to our YouTube channel, and we'll have a link in our Instagram bio, or you can email us at asiansinvetmed@gmail.com for a direct link. And we just want to thank you all for attending. And if you have any additional questions, feel free to send us an email, and we'd be happy to send it to Dr. T and Dr. Kim for any direct questions, things like that.
Yeah, I put my phone number and email. Please never hesitate to contact me about anything. Okay, I'm here for everyone.
Don't contact me at all. No, anytime, reach out to me. There's tons of links of how to get a hold of me. Feel free to call, email, text, whatever. But this has been great. Thanks so much for having us. I had a great time.
Thank you guys.
I really appreciate you guys, talking with us. And again, it's been wonderful, and you guys have such insight, and you've been in this field for so long. So it's definitely, makes us feel wisdom and has taught us a lot of things that we want to do now as practitioners. So I love it. Thank you guys so much. And I hope all of you who have attended and everybody has a great evening.
Jenny, right. Asians don't raise and don't feel bad about being old. Okay, guys, take care.